Blood clots can block blood vessels and prevent the flow of blood and oxygen to the cells. The red blood cells, white blood cells, and platelets can become stuck to the clot and cause it to increase in size, increasing the risk for certain medical issues. Blood clots can form in the bloodstream, known as thrombus formation. When these blood clots flow in the bloodstream, this is known as an embolism. Blood clots are made up of hardened blood that forms as part of the coagulation process. Blood clots in the arteries and veins can cause deep vein thrombosis, pulmonary embolism, stroke, heart attacks, and potentially death. This is a normal blood flow. Early detection is necessary to treating a blood clot before any serious medical issues can occur. According to the National Blood Clot Alliance, an average of 274 people die every day in the USA from blood clots. The BCD provides early detection of blood clots in real time to allow the earliest possible diagnosis and treatment to assure the health of the patient. Blood clot-related diseases like heart attacks and strokes cause irreversible damage to critical organs. Early detection of clots before they affect major organs is the first step to allow effective treatment. With a blood clot detector, blood clots will be detected as early as possible, thus allowing medical professionals to treat patients prior to the onset of life-threatening conditions like strokes and heart attacks. The BCD makes all of this possible through its three main components. The first component is the implanted sensors, which collect data on the patient's clot size, clot quantity, heart rate, and cumulative clot burden from their position on the interior wall of major blood vessels. The internal communication module component is placed under the skin above the heart and receives information from the sensors via Bluetooth and relays this information via an encrypted signal to the patient's phone and to the doctor's interface. The doctor is then able to use this to determine the best course of action for the patient. When the clots flow past the sensor detects them and sends collected data to the internal communication module. Then the internal communication module processes the data and transfers it to the medical professional's interface and the patient's interface. The patient interface depicts the patient's heart rate and the number of blood clots detected by the sensors so the patient knows when to visit the doctor for treatment for blood clots. The medical professional interface has more information so that the doctor can better treat the patient. In addition to the data provided to the patient, the doctor's interface provides clot size and cumulative clot burden. The BCD is a proactive and predictive medical device. The unique ability to detect clot quantity, clot size, heart rate, and cumulative clot burden and provide this information in real time remotely to a doctor will allow medical professionals to diagnose and provide the earliest treatment to the leading causes of death.